I'm Pam Madden. I was born and raised in Dayton, Ohio. I married my high school sweetheart. We're going to have our 45th anniversary this year. I have 2 children, both adults, 5 grandchildren, and I have been a nurse midwife now for 22 years. I went to Alter High School here locally. I went to Kettering College when I chose nursing as my profession. And then I went to the Institute of Midwifery, Women and Health for my certificate and midwifery degree. I knew nursing would always be what I wanted to do. I started as a candy striper in high school, and then I worked in a nursing home. After I married and had my children, I went back to nursing school and obtained an associate degree. And I worked as a labor and delivery nurse for the first 15 years of my career. And then my best friends and I all chose to go back to school together to form a midwifery circle here in the Dayton community. My philosophy is to try to meet a woman where she's at when she comes and I'm introduced to her at the practice. She might be a young teenage mother with an unexpected pregnancy, or she's there for birth control, or she's there for the pregnancy, or as she ages and has symptoms of perimenopause and menopausal symptoms. So as a nurse midwife, we get to be involved in that entire lifespan, and we can help find them at both their physical state, but also their emotional state, what kind of support systems they have in place. All of their mind, body, soul then will determine how best they'll be able to parent that baby they're growing inside of them. When I was a labor and delivery nurse, I met the woman just in that crisis, vulnerable time, but then I left sometimes before the baby was even born. So now I get to meet them sometimes before the baby's even conceived and get to be with them throughout that whole process. You know, I appreciate that a patient, when they come to Lifestages, they're choosing a practice that has a diverse group of people. We have the midwifery practice, we have the physician practice. We use our physicians for needs that we don't use in our skill set. We have someone always involved with us if our deliveries, for whatever reason, would need to have physician involvement. We are also able to have a Euro team that is well-staffed with physicians, and the PAs work very closely with them. We all appreciate delivering now midwifery practice. We appreciate from the midwifery practice now that we deliver at Miami Valley South. I was a nurse here. I was one of the first staff members of Family Beginnings here at the Valley. I helped build Family Beginnings, and I appreciate now at South we can have a patient that goes from the traditional water birth experience to a very more medical model experience needing other skill sets. We appreciate at Lifestages that we serve from North Dayton to South Dayton. I was first, the practice was predominantly out of Good Sam, so we appreciated being part of that neighborhood, meeting the cultural needs that some of the women have specifically in that neighborhood. And we have a centering program in our practice, which is a group model of care. So instead of a patient coming and just meeting one-on-one with us for the time frame that's allotted for their visit, they come in a group setting, and you can be a very quiet personality or more of a vocal personality. The group truly meets the needs of everyone. The more pronounced personality might bring up some subjects that the quieter personality is thinking, well, yes, that's what I was thinking and feeling as well. And so it's very educationally a positive experience for our patients.